Hi, my name is Rachel Zimmerman. This oral report is over Niemann-pick Disease Type C. It is autosomal recessive, which means that both parents are carriers. There is a 25% chance that their child will be unaffected, a 50% chance that their child will be a carrier, and then 25% chance that their child will have the disease. It is a genetic metabolic disorder that affects the lipid storage and transport in the body of lipids to the cells of the body. A researcher by the name Peter Pinchev found that cholesterol is the most dominant storage lipid used by the body. In the normal body, cholesterol is taken into endosomes from the extracellular space. It is infused with lysosomes, transporting the cholesterol. After it is transported to the plasma membrane, it leaves the neuron after oxidation. However, with Niemann-pick disease, transport is blocked in the endosomes, the lysosomes, and the Golgi apparatus. Because of this, endosomes, lysosomes, and the Golgi apparatus expand and do not function properly. This results in the neuronal cell death. Symptoms at onset of the disease can be seen as early as pre-birth, where liver and spleen enlargement can be seen. At birth, the child would be jaundiced, and more often than not, the child would not survive infancy. All ages have the liver and spleen enlargement. Most of the ages have a condition known as vertical supranuclear palsy. That covers most of the ages at onset. And this disorder is when the eye movements are erratic, moving left and right, up and down constantly. At 1 to 3 years of age, the symptoms are seen in the delay of motor development and low muscle tone. At ages 3 to 10 years, the symptoms can be seen in clumsiness, movement and speech development problems, and loss of muscle tone. In the adolescent to young adult age group, the symptoms can be seen in lack of voluntary muscle coordination, seizures, and loss of muscle tone. The most common symptoms of adult onset are not very common, but they are neurological and Alzheimer's-like symptoms. Niemann-pick in adulthood is not very common. Most patients with Niemann-pick Type C do not make it past childhood. There are a few ways to diagnose the disease, but it is mostly seen by a skin biopsy, where the cholesterol or the skin specimen is observed to determine how cholesterol is stored. DNA tests can also be done to find the Niemann-pick Type C gene. Bone marrow tests can be performed. Also, at this time, there is no cure for the disease. There is a drug called miglustat that can be taken, but it only curbs the symptoms of the disease. Research is still being done to find a cure for Niemann-pick Type C. This disease affects all ethnicities, but with Niemann-pick Type C, there are ethnic groups that are affected more often than others. It is most common among the French Acadian of Nova Scotia and the Puerto Ricans of Spanish descent. There is a foundation named after the well-known football coach of Notre Dame, Ara Parsekian. The foundation was started in honor of 3 of his 4 grandchildren who passed away at a young age from this disease. In the 14 years since its inception, the foundation has raised a total of $33 million, in which 88% of that has gone to research for the disease. Thank you for taking the time out to watch my video.